cell in your body. There isn't an exception, whether it's an immune functioning cell or a nerve functioning cell, doesn't make any difference. You got your cell here. Now what's going to happen is, out here, in the room air, you've got some oxygen, and you're going to get that oxygen into your cell by breathing and pumping it along to the cardiovascular system. It's interesting to know that there's very few things that can happen with oxygen. If we talked about B12, or if we talked about vitamin C, or if we talked about just about any nutrient, or if we talk even about water, we can talk about all these things that they do. But when we talk about oxygen, it's kind of fun. It doesn't do that much. It only does a couple of things, but they're pretty darn critical, aren't they? They're the most critical thing that goes on in your body. Now, as a researcher, that's fun to know, because that means since it only does two things, I can track it pretty well. If we have enough time, I'll talk a little bit about how to measure and track oxygen as it moves through your body. But oxygen either can go into your cells and produce energy, right? Or it can go into your cell and produce free radicals. In a healthy, efficient cell, the 35-year-older type cell, 98% of that oxygen is going to produce energy, or more is going to produce energy. You're going to get free radical formation, which incidentally you need to be healthy. But you're not going to get more than 2% unless there's a acute toxicity. So in a healthy individual who's not in a state of acute toxicity, less than 2% of that oxygen does anything other than be converted to energy. In the process of converting oxygen to energy in this cell, the cell is either going to burn fat or it's going to burn carbohydrate. When it burns either one, it produces acid. But when it burns carbohydrate, it produces twice as much acid. In fact, probably even more than twice as much, because when you burn glucose, there's always going to be a certain amount of it going to lactic acid as well, outside of the mitochondria. So, as you burn more and more glucose, you're going to produce more and more acid. As you burn less and less glucose, more and more fat, you're going to produce less and less acid. First thing to remember. Second thing is that when the oxygen comes into the cell, you have one of the universe's highest energy molecules called oxygen, very stable but high energy molecule. And it's going to be reduced in the cell to water, so very low, the lowest energy molecule in the world. You've got high energy going to low energy. As it makes this transition, of course, energy gets released. So what you are, in fact, is you're acid makers, okay? And if you're an efficient utilizer of oxygen, you don't make as much acid, but you are acid makers. You're also water makers. So basically, your job is to make acidic water. That's what you do all day long. If you're a really efficient utilizer of oxygen, you're going to make a lot of water and not as much acid. If you're an inefficient utilizer of oxygen, you're not going to make as much water, and you're going to make more acid. And all of this is going to determine your health and your longevity over the years. And so that's what we're going to look at and move along with some of those thoughts. Oxygen is a nutrient, but oxygen is kind of like gravity. You don't usually get up every morning and start thinking about gravity and its implications for the day. Because it's all around you. It's so pervasive. It's something that impacts every second of your life in such a dramatic way that you can't really think about it. Just take it for granted. It's going to be gravity today. Oxygen is kind of like that. So if I were to ask everybody in this room, what's your idea of the most important nutrient you could give to a patient? Probably nobody would think oxygen. Although we all agree that's clearly the most important nutrient. It's a forgotten nutrient. Just don't normally think about it. Why is that? Well, you can measure oxygen, but we don't routinely measure oxygen, do we, unless somebody's short of breath. how many other nutrients, including water, you can be completely without for 5 minutes and be dead. Oxygen's that nutrient. The other thing to remember about oxygen is not just what you take in, is it? You can take in oxygen, but if you can't process it, if you can't utilize it and produce energy out of it, you're going to not get any value out of it. It's the same kind of idea. Your nutritional status isn't what you eat, it's what you eat to utilize, right? Same is true for oxygen. So while you're sitting there breathing oxygen, you might be wondering to yourself, I wonder how much of this stuff I'm really utilizing well. Now, if you wondered that, and you wanted to go out and find out how well you're utilizing oxygen, what would you do? Well, you'd be sort of stuck. There's not a lot of ways that you can go and measure how well you utilize oxygen. One would be, just go run around the track or go run up and down some stairs a few times, see how well you do that. And start thinking about, how well am I doing this compared to how well I used to do this when I was a younger person. And that'll give you an idea how well you're utilizing oxygen. Because starting somewhere around the age of 40, and it can vary from 35 to 45, but right around there, I usually like to pick on the age of 40. Starting right around in there, your ability to utilize oxygen to produce energy starts to decrease. We'll see the graph of this in a second, but it's going to start to decrease. And that decrease is going to be steady. And as you utilize oxygen less and less, where's all that oxygen going if you're breathing in? It's not like you're breathing less. It's going in your body, but you're not using it to produce energy. Where else is it going? Free radicals, right? So the less oxygen you make energy out of, you get a nasty little effect. You get too many of these free radicals floating around, which ultimately are going to be your demise. And you don't have enough of the energy around, which you need to be healthy. Every single cell in your body, that's what powers up your body. So that the critical difference between a 20-year-old and a 70-year-old on a cellular level, if you look at the big difference, it's just this. It's simply how efficient they use oxygen. There's published animal studies out there that show this to be very clearly true. You transplant mitochondria into old cells, they behave like young cells. If you're a 70-year-old person in this room today, your cells in every way other than oxygen utilization function just as good as they did when you were 20 years old. So in essence, as we grow older, we get that 40-year thing and we start going beyond 40 years. As we get older and older, we start becoming like really good flashlights with fading batteries. What if you could just recharge the battery? But if you could switch a new battery in there, we behave on a cellular level just like a younger person. So the key to the treatment and the prevention of disease is to do just that. It's to get to be old and have perfectly good oxygen utilization. The other day I saw a patient who's 84 years old. This is my record. This is the best I. This is like 3 or 4 months ago. I had a fascinating story. I'm going to tell you the whole story, but basically this is it. At 84 years old, he has the oxygen utilization deficiency, which is usual and typical for the average 40-year-old man who's height and weight. On a cellular level, this guy is a 40-year-old man. He's functioning like a 40-year-old man. Now, how do you get to do that? It wasn't by accident. And we'll talk a little bit about how all this happens today. And the gist of this is going to be a little bit about how you can use oxidative therapies in your practice. Because again, you're going to operate on the 35-year-older or you're going to operate on the 70-year-old. Which would you rather operate on? A 35-year-older with oxygen utilization is typical of a 70-year-older, or a 70-year-older with oxygen utilization is typical of a 35-year-older. I'll pick that 70-year-old guy every time, because I'm going to get better results. So we'll talk about how you can do that. I want you to think locally and systemically. And this is something we started to realize 4 or 5 years ago, because it was around that time that I started to realize, you know what? If something hurts in my patient, if any of my patients have pain, and I inject ozone in there, it goes away. body, all the cells in your body, over time begin to not utilize oxygen as efficiently. But also it happens in little areas. So little areas of your body might be very poor in oxygen utilization, whereas the other areas surrounding that would be good, much better in oxygen utilization. So if it hurts, there's a chronic infection there. There's any osteonecrosis in an area of your body, I guarantee you, in that area, there's localized decreased oxygen utilization. So, yeah, you can treat the whole patient, which I would hope you would do to improve their overall oxygen utilization, or you can just treat that given little area where you're having a problem to improve the oxygen utilization there. Without doing that, it's going to be like, again, trying to make that 70-year-old patient feel like a 35-year-old, and it might not work so well if you don't do that. What we'll talk about today, too, is oxygen utilization and the fact that it can be measured. I alluded to the fact that I had developed a test, and get around to it to talk about that. But you can measure oxygen utilization. So that's what I do in my practice. Like that 84-year-old guy, he comes in, we measure his oxygen utilization. He's got the oxygen utilization of a 40-year-old. What do you think I told him? Nothing. Come around next year. Well, by the way, whatever you're doing, keep doing it. Apparently it's working. Now, normally I don't see that, right? Normally we see people that have the oxygen utilization that's actually not all that great. And so we'll set about telling them to do some things to improve it. But you can measure it and you can improve it. That's the good news. So let's just get it turned down by oxidation, oxygen utilization. We typically mean the same thing. There's a lot of different words for this. It's kind of it's the process whereby oxygen metabolizes either fat or glucose into water, energy. NAD stands for nicotinamide adenine dinucleotide, ATP. We're going to go over all this. Today, my goal with you today is not so much, well, not at all to teach you how to do oxidation therapy, as to give you an understanding of why you want to know how to do it. And you know, there's some interchangeable terms that you can see in the literature in here people talk about, and I might use them interchangeably today. We talk about oxygen utilization efficiency. We can talk about mitochondrial function. We can talk about oxidation efficiency. We can talk about oxidation potential. It's all referring to the same concept. Your ability to take oxygen and process it in an efficient way towards water and energy, so less than 2% of that oxygen actually goes to free radical formation. That's what I'm talking about. Now, why is that so fundamental? Well, because there's not one physiological or biochemical process, not one, in the human body that isn't absolutely rate limited by how well you can oxidize, how well you can utilize oxygen. And when I say, I'm saying using the term rate limiting purposefully, because it's just not, well, you know, if you don't get a B12, maybe you don't do the job quite as well. I'm talking about to the degree that you can utilize oxygen. You can only utilize oxygen 60% as well as you should. Every single factor that goes on in your biochemical physical health is going to be reduced by 40%. Every single one is rate limiting to everything that goes on. A couple of things that you would point out here, besides the obvious organ function and senses, is this. This is pretty big, especially to people as they get older, and especially to surgeons who are busy operating and doing things to people where they need those people to repair well. Your ability to repair damage to your body, i.e. get rid of that pain, is absolutely dependent on your ability to utilize oxygen. In fact, when your patient comes into you and says, you know, it hurts right here, I guarantee you the pain is being caused by lactic acid that's being produced in excess because that patient can't utilize oxygen very well. And if you don't remember how this system works with the anaerobic and aerobic metabolism, we're going to talk about that in a second. But as you don't utilize oxygen very well to produce energy, your body goes into anaerobic metabolism as this kind of a stopgap maneuver not measuring and determining how well your patient's utilizing oxygen, you're just guessing in terms of throwing B12 at them or glycine or whatever it is you want to do to help detoxify. You may very likely be throwing in a whole bunch of substrates and nutrients that can't work because guess what? They don't utilize oxygen so well. So these are extremely critical processes that we see in healing and in aging and disease prevention, all of which are absolutely dependent on oxidation and ability to utilize oxygen well. This is from Ward Dean's book, and here's somebody out here. This is how well they utilize oxygen. Okay, in this case it's VO2 max, and you're looking at a 30-year-old here, and this is what happens. This is what you can look forward to as you get older: a slow, steady decline in your ability to utilize oxygen. Now it's nothing you're going to notice. It's like watching grass grow, right? You're not going to notice this. If you are a world-class athlete, you might just notice around the age of 35, 38, you're just not doing what you used to be able to do. Just can't do it. But for normal, everyday human beings, you're not going to notice this decline at all until it gets down to around this level. Here you started off here. When you get down about half that much, things start actually falling apart. That's the age of 65. Things actually start falling apart. And then it continues to fall apart. Now here's the cool news. Here's your 85-year-old guy who's got his line still up here. So he's going like this. Now how in the world did he do that? That's what we'll talk a little bit about today. Let's see how good this time was. Okay. I'm going to go over these slides pretty quickly. I think they're absolutely fascinating slides. In fact, I think I'll just skip it. Okay. Okay. All right. So those slides were about some experimental data with mice that proves everything I just told you. And I don't want to spend a lot of time on them because I've got bigger fish to fry. But basically, when you take mice and you experimentally look at how well they utilize oxygen, you see that the poorer the mice utilize oxygen, the greater the onset of the age-related phenotypes like kyphosis, osteoporosis, heart failure, and infertility, blah, 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 hair falling out, all that kind of stuff. The greater you see that, and also the shorter the lifespan. This is basically what I was just telling you. So there are animal studies to back me up on everything I'm telling you. I'm just going to go through these real quickly. I'm not going to spend much time at all. I just want to impress upon you that if you go to PubMed and you plug in mitochondria and a disease, you're going to get a whole bunch of stuff to look at. It's associated with every disease there is. So the mice studies show us that the mitochondrial function and oxygen utilization are associated with the very process of aging, what causes us to fall apart, become weak and frail. And it's also the root cause of every disease. So it is kind of important. We'll just shoot right through these, but this talks about osteoporosis, macular degeneration, hypertension, all the autoimmune disorders or all oxygen utilization deficiency disorders. Cancer, of course, is. Warburg showed that many moons ago. Diabetes is classic. I wrote a book on diabetes called the Type 2 Breakthrough, Diabetes Breakthrough, which is all about energy production and diabetes stuff. Type 2 diabetes is 100% preventable. Nobody ever has to get it if they just take care of their mitochondria. Parkinson's, Alzheimer's, heart failure, any kind of heart condition. Tons of data on mitochondrial dysfunction. And, you can pull up not as much stuff, at least I was able to find as much stuff. I just plugged in periodontal and mitochondrial and came up with these three. I think I got some like 80 things came up, and I just grabbed these three off the top. Cytochrome C oxidase, how these one of the key enzymes involved in oxygen utilization. And so there's plenty of data out there to back me up on the fact that poor oxygen utilization is what ultimately causes us to age and what ultimately gives us diseases of all kinds. Now, how common is it? And how do you know you have it? Well, it's really, really, really common. This is an article that I published not too long ago called The Energy Deficit Theory of Aging and concept mitochondrial dysfunction refers to deterioration of the mitochondrial function. In other words, an inability to optimally utilize oxygen. That commonly okay, occurs in the young and asymptomatic, and gets worse as you get older. Now that doesn't sound very good, does it? So let's look and see what we did. We basically took 50 subjects. We just randomly selected them. These are people that felt good. They were asymptomatic. They were coming to my clinic to get their oxygen utilization measured. Now, who the heck is going to go to somebody's clinic, get their oxygen utilization measured if they're pretty health-oriented? So here we got a group of kids between the ages of 20 and 40 who felt healthy, many of whom exercised, pretty darn good shape, health-conscious individuals. We're not just talking about Carson City alone. In all kinds of places, Los Angeles, Singapore, different places. We took the data and we just analyzed them. Find out in terms of oxygen utilization how well they were doing. Well, 54% had normal mitochondrial function. Well, that's nice. And you see what a thought, isn't it? In this particular group, now imagine what if we'd have taken people aged 40 to 60 who didn't feel so good. 46% of them, the rest, had early onset mitochondrial dysfunction. In other words, at that age, at that time, with no symptoms at all, they were already showing signs of problems. This is an extremely common issue. You have no idea how much of this is an issue until you actually start to measure it. And the point is this. What you want to do is not focus your efforts on these guys. What you want to do is focus your efforts on the other half who are walking around thinking they're all healthy and they're certainly asymptomatic. But it gets worse. 36% of them had less than 90% of predicted. 26% had less than 80% predicted. 12% had less than 60% of predicted mitochondrial function. And there are some guidelines in the literature that would cause them to be eligible for disability payments based upon that. And they're asymptomatic. Isn't that fascinating? So they're getting by. But they already have some severe problems. So why would that be? I think you probably all know the answer is toxicity. Clearly it's toxicity. But I find that fascinating. 24% of the subjects with normal function had decreased fat metabolism. But 100% of the subjects with IAOMT had decreased fat metabolism. This is a key little thing. The first thing that goes is your ability to burn fat. Now remember what I told you. When you burn fat efficiently, it's done in the mitochondria, and you produce some acid, right? But when you don't burn fat efficiently and you have to burn glucose instead, you're going to get a shift. You start burning more and more glucose, less and less fat, it's going to be making more and more acid. The body's going to break down. This is a vicious cycle process. It just builds on itself. So these kids are starting off, and all it's going to do is get worse and worse and worse and worse until someday something's going to happen. We could go on, talk about the cost of this in these young people. But probably the thing that I would focus on a lot more is decreased membrane potential. They aren't going to be able to maintain the membrane potential, which means things are going to start to break down. They're going to have, as we already talked about, increased free radical issues. They're going to be unable to detoxify as well. And the whole thing is basically going to fall apart over time. So it's an important issue. I kind of hinted this to you a little bit. As you can't burn oxygen, as you can't utilize oxygen efficiently, what are you going to do with that oxygen? You can't utilize it to produce energy. What's it going to do? Well, what it's going to do is it's going to make free radicals. So this is a quote from the classic text by Levine and Kidd, wherein they say that decreased mitochondrial function is toxic to the cell by exacerbating free radical generation in membranes, housing electron transfer assembly. So as you don't utilize oxygen as efficiently, the assembly that allows you to utilize oxygen efficiently becomes damaged. And it gets worse, and it catapults, until the tip of the iceberg starts showing in some that disruption isn't fixed, you're going to have a hard time. You might probably it's going to be impossible to get that patient actually well. Kind of works like this now. At the top here, various factors are going to create early onset mitochondrial dysfunction. That could be nutritional factors, could be stress, could be bad lifestyle choices, could clearly be toxicity, could be decreased hormone production, could be bad diet, all kinds of things are going to start that right up there. And that's going to lead to this decreased mitochondrial function, which in turn causes increased free radical formation. Now, normally we don't care about free radicals. In fact, I just told you that you need them. You need free radicals in order to be alive, to be healthy and function. We don't think about them too much because we contain them, we control them. It's not a big deal. We have all these free radical antioxidant buffering systems, superoxide dismutase and glutathione peroxidase, calases. We have these enzymes that are going to contain them and hold them. Not going to be a problem. But guess what? For your body to make those enzymes, what do you need? You need ATP to make them. So if you're here and you're not making much ATP and you're getting all these free radicals, what aren't you getting? You're not getting the enzymes to take care of it. Now you put that along with that, you get this. The electron chain assemblies start breaking down. And of course, as they break down, it gets worse, doesn't it? It's a vicious cycle stuck in here. You can be stuck in there for 10, 20 years and not know it. Unless you're some kind of athlete, you might notice your times are getting worse. Or you might notice you keep getting injured, they don't heal up as well. Ultimately, though, this is what the end product is with this. So what we'd like to do is get in around this point and start doing something about it. So let's just go through a summary here. Oxygen is converted to water plus energy. That process is called oxidation or oxygen utilization. Free radical damage to the mitochondria inevitably occurs as a result of that process. So you can't get out of this. Now, you did it really, really, really well, so the later you're going to die. But the longer you're alive, the more you're going to have accumulated that damage. However, the less efficient the process of oxidation is, the more that's going to occur and the more rapidly that occurs. And the accumulated free radical damage leads to actual breakdown and eventually you die. This breakdown is the central lesion in the entire aging process and all the diseases and all your dental issues, everything, detoxification, all of that. It's the central lesion. And aging degenerative disease is determined by your starting point, which is your genetics, can't do much about that, and your rate of mitochondrial decay, which is how you take care of those genetics. And yes, you can do a lot about that. Mitochondrial decay is inevitable. What's not inevitable is the rate at which you do it. And that rate is determined by one thing, and that's your efficiency. Efficiency when you use oxygen. Okay, already mentioned it happens locally. How does it happen locally? Well, you know, your body's supposed to fix itself. And that's what it does every day. Every day you're like stubbing your toe, or you're doing something where you create some kind of injury in your body and notice that it's injured and you don't think much about it, because you know darn well in another few days or maybe weeks or something, it's all going to be fixed and it's going to be fine. Until one day, somebody somewhere wakes up and thinks, you know what, I got that injury like 9 months ago, and it really should have been gone by now. What's up with this? I guess I have a chronic hip problem now. But why did I have that chronic problem? How come my body didn't heal itself? It healed itself all these other times. Why isn't it healing itself? Well, with all chronic disorders, and this would be mechanisms, and the condition becomes chronic because you've got this edema, inflammation, hypercoagulation, endothelial damage that's disrupting the mitochondria. Now the mitochondria can't oxidize to heal that, and in turn worsens it. And you've got a chronic issue going on. So here's the thing, folks. You take a syringe. I like to put some procaine in there, some B12, some folic acid, good mineral combination, and you stick it where it hurts, wherever the problem is, could be periapical, wherever the problem is, and you inject some of that in there. And right after you've done that, you shoot some ozone into the area. And guess what? Little magical things start to happen. Whether it's a knee, or it's a shoulder, or it's a neck, or it's a back, or it's like the guy that came the other day that had some pain. I don't even know why he's got the pain. It's on the lateral side of his leg, about 4 inches below the tibial junction there, tibial junction. Right in the middle of his leg. I don't know. He doesn't have providers. I don't know when he's got there. But I just did what I told him to him. Cure him, fix it, gone. So a lady, maybe a year and a half ago, that came with a chronic groin pain. But had CT scan the whole deal, had it 15 years, nobody knew what it was about, just couldn't fix it. Nothing could fix it. One injection, what I just told you, she's cured today. I just talked to her about like last week. One injection. Why? Because you're treating the disease. You're treating the disorder. You can cut it out, I suppose, but I think this is more elegant. Sir William Osler, considered the father of medicine. I just do this thing because I love this quote. One of the first duties of the physician is to educate the masses not to take medicine. I don't think we're following Sir William anymore. Okay, so this is kind of what it gets down to now. We'll spend some time on this. See how it goes. But, the slide isn't as terrible as it looks, so maybe it is. Perhaps over there. Okay, well, I'm not going to spend any time fixing it. But here's glucose. Here's your fat supplies. The blue thing here is the mitochondria, okay? So remember, here goes glucose into the mitochondria. Here goes your fat into the mitochondria. Now, there's all kinds of things around this slide that are messing it up. Insulin is up here, it's playing a role. Cortisol is playing a role. Certain amino acids play a role. There's thyroid up in there, that plays a role. There's some other key nutrients like lipoic and carnitine and such, but kind of ignore those for the time being and say, yeah, okay, so fat gets into the mitochondria. Glucose gets into the mitochondria. And in the mitochondria, there's this thing called the Krebs cycle. And what the Krebs cycle actually does is take this thing, NAD, remember we started talking about that, 6-ketamine, adenine dinucleotide, takes that and sticks the hydrogen on it. That's, by the way, if you didn't know what the Krebs cycle is for, that's what it does. It sticks hydrogens on NAD. But its job, it's a pretty critical job. Because remember, oxygen is going to go through water, it's hiding behind here. Oxygen is going to go to water. And in order for O2 to go to H, or H2O, I need the H part. So that's where you get the H part, from NADH. So NAD goes in here, picks up the hydrogen, comes on out here with the oxygen that interacts with that, and through the electron transport system is able to pull that hydrogen off, reduce the oxygen to water, with the subsequent release of energy, and incidentally, more NAD. That NAD can now go back to the Krebs cycle and pick up another hydrogen. And the whole process is working pretty cool. But this NAD does a lot more than that, doesn't it? NAD is all over the map on this. And I want you to know that even if we weren't looking just at what the mitochondria is doing in this little schematic I've got here, we could show NAD doing lots of things biochemically all over the body, particularly in the liver for detoxification. But what I'm showing you here is true for every single cell in your body. So look at where NAD is. First of all, in order to metabolize glucose, you don't get off first base without NAD. Forget it. You can't even do anything with it. If you do get off first base, you don't get in the mitochondria without even more NAD. Notice you need a little bit more NAD for glucose to get metabolized than you do with fat. Glucose is a little bit more demanding. And of course, you can't even do anything with oxygen without NAD. In fact, if you look at the inside of this Krebs cycle, it's driven by NAD. The whole process is driven by NAD. So let's talk a little bit about what happens if you don't have enough of this around. Let's say, for some reason, and I'm going to give you a couple ideas of what the reasons may be, but let's say for some reasons, this whole process is slowing down, your mitochondria is slowing down. One reason could be you smoke. One reason could be that you have asthma or some problem with your lung. One reason could be you're getting exposed to carbon monoxide in your environment. You don't know it. Another reason could be you've got heavy metals, or what they call uncouplers, that you've been getting exposed to and you don't know it. Another reason could be trans fatty acids. You could have certain nutrient deficiencies. You could be taking statins and not have adequate amount of CoQ10. You could have any one of these hormonal issues out here. You could have any one of these nutrient issues out here. But let's just say that you got some kind of combination of that, like these kids did with the IAOMT, where their mitochondrial processes start to slow down. That means, as the mitochondrial processes start to slow down, you're not going to have enough NAD, are you? You can't make the NAD so well. Well, when you can't make the NAD so well, what happens to everything else in this whole process? It starts to slow down. The whole thing is driven by NAD. What little NAD you do have left here, as this process is slowing down, mind you, you're going to have some NAD left, not going to have as much as you used to. But what little you have left is immediately going to go to that Krebs, and you're going to see a shift in the ratio of NAD to NADH, such that you're going to have a lower NAD to the NADH, okay? So that means you're going to have a little bit more of this NADH. Now in a minute here, I'm going to show you what happens. But as this ratio shifts due to the IAOMT, okay, if the ratio shifts, and you get more of this stuff, your body is going to create more and more free radicals. The body doesn't like it, so what's it going to do with this? It's going to get rid of it. It's going to eliminate it out of the body. So ultimately, as time goes on, it's a slow process, right? But as time goes on, what you're going to see is a normalization back to the normal ratio, protecting your body from excessive free radical damage, but an overall deficiency of NADH. Okay? Now you come along and tell the patient, you know what? You've got an oxygen utilization disorder. You need to go out and start jogging. And so the patient says, fine. So they go out and start jogging, and ultimately, if they do it right, they can build this whole thing up. But what are they going to need? In order for them jogging to work, they're going to need some NADH, which is a pretty little co-pack. You can go out and buy this stuff now. So the key here, the take-home message here at this point, is that when you're resuscitating mitochondria, give them some NADH, because they're already deficient in it. Now, it comes from niacin, but you can actually go out and buy NADH now. Start getting 5 to 10 milligrams twice a day to the patients, and then send it out jogging. You get a lot more bang for your buck. Also, if you want to treat a localized problem, you can do the same thing. Give it some NAD or some niacin, NADH, and or niacin, and then treat the area locally. You'll get some bang. So, and this is kind of what I was just saying. Cells are geared to maintain a constant NAD to NADH ratio. That ratio wants to be about 1, okay? Too high a ratio causes oxidant stress. In other words, you have too much NAD. Too low ratio causes decreased oxidation. If you don't have enough of this stuff, you can't get off your face, right? You can't utilize the oxidation. So decreased oxidation leads to a decrease in NAD and a relative increase in NADH, manifested by change in the ratio, which is all over the literature. You can measure all this stuff if you want to look it up. I teach a course in this, and in the course we go over all these references. And the excess NADH is removed in order to reach a new equilibrium, so the decrease in NADH further decreases oxidation, and oxidation therapies reverse this trend by increasing NAD. So here's what you do. You take your oxidation therapy and you give it to a patient who doesn't have much of this, and they have that, and you oxidize it. So you deoxidize NADH. You give them some NADH first, right? And right after you give them some, you oxidize them. You know, do an oxidizing therapy. What's an oxidizing therapy? Jogging. An oxidizing therapy. Exercising with oxygen is an oxidizing therapy. Ozone is an oxidizing therapy. Hydrogen peroxide is an oxidizing therapy. Hyperbaric oxygen is an oxidizing therapy. Large doses of ascorbate are oxidizing therapy. There's all kinds of ways to oxidize the NADH to NAD. But look what you do. Why do we get such a sudden and dramatic bang for our buck when we do this? Because NAD is all over the place. We're loading up a lot of NAD, and it's going to drive a whole mechanism, and it's going to completely resuscitate the mitochondria. This is a nice reference that came out a few years ago from Current Opinion Cell Biology, 203. NAD has emerged as a putative metabolic regulator of transcription, longevity, and several age-related diseases, including diabetes, cancer, neurodegenerative disease, basically everything. Calorie restriction has been shown to decrease the incidence or delay of the onset of all those diseases. And in this study, they used yeast, but they discovered that calorie restriction functions by increasing the NAD level. So if you don't want to do calorie restriction so much, if you're not all that much in calorie restriction, you can actually just oxidize NAD and get the same thing. So I thought I'd put this in as well. You don't take those talks where you go to it, the guy does all this stuff, and never, you know, in the last 30 seconds tells you what you actually do to fix something. So this is what I do. I have a pre-injection solution which has 14 cc's of 2% buffer protein. And I put 4 ampoules of CoCom in there, DHI, and 4 ampoules of biscamalin forte in there. And then that's my regular little solution. I'll draw 4 cc's of that solution and add a little B12 folic acid, a real solumedrol, just what I call a drop off, just enough to barely fill up the lure line. And then I put in some quintamarine, which is a trace mineral type of solution. And then also Custat, make a homeopathic remedy out of that. So Custat 20 times. And then I'll inject that all around the periapical spaces, or whatever, bad knee or whatever it is. And then follow it up with an injection of some ozone at 9 gamma. And the problem will immediately go away. And if it's a tooth, you might have to do this a number of times to actually fix it. And I know that Dr. Malika actually drills holes. I know he teaches this too. And he'll teach you guys how to drill holes and shoot these things directly into the cavitation, directly into the affected area, so that you don't have to go and just, you know, surgically cut things out. You can actually treat the problem that's causing it in the first place. I've got a few more minutes left, so I'm going to take just a moment here and just mention that you can measure mitochondrial function, and I hope I've convinced you all today that that's an important thing to do. We know that it's important for people not to have a blood pressure that's too high, but saying that would be absolutely meaningless if nobody had a blood pressure problem. Who had the problem, who didn't. Furthermore, if they had the problem and you were giving them a blood pressure pill or whatever you're doing to get the blood pressure down, you wouldn't know if it's working or not. So if you think mitochondrial function is important, then you probably think measuring mitochondrial function is important. Here's the good news. You can do it. You can do it accurately. We use an FDA-approved pulmonary gas analyzer, and the computer program does the test. Whole test takes about like 45 minutes. There's a number of centers that now do this. A lot of practitioners are starting to get on board with this around the country. You can find a list of them, by the way, if you're curious, by going to bioenergy testing, bioenergytesting.net, and it'll tell you about some of those guys. That's kind of what the equipment looks like. You need a little room to put it in. That's measuring how much oxygen is going into its body. Now it's also measuring how much carbon dioxide is coming out, because by measuring the carbon dioxide coming out, we can actually determine how much ATP he's making in real time. When we exercise, so we do it with some rest, you get basal data, and then exercise data. ATP production is directly correlated with OT utilization. So all I got to do is measure O2, throw it in some this and actually see, some more scientific type stuff, and I get into all those formulas, which I didn't have the time today for. But if you actually want to get into that, you can go to my website, which is antiagingmedicine.com. And there's a whole list of the videos. I've posted all these videos on the internet now. There's a series, a 4-part series on energy, health, and bioenergy testing. And you can click into that, and the first 2 or 3 kind of set you up, kind of get warm and cozy, and then the last 2 are starting to get real doctory and real biochemically and all that kind of stuff. But your patients can watch the first 2 and certainly get those, and we might watch all of them and start having a solid foundation of how to do this testing and why it works and why it's good for you. And then also, we do offer a ozone course. It's not really geared towards dentists. Still, Monica has a course geared towards dentists, but many physicians want to learn how to fix rotator cuffs, want to learn how to fix bad hips, bad knees, bad backs, bad necks, bad more or less anything. I mean, literally fix it, easy, without any side effects. We do offer a course in that twice a year. Next one's going to be in Reno on May 15, 17. I have some brochures on that course if anybody wants the brochure. You can also learn about all future courses in ozone therapy, both for the dental kind that Dr. Monica is doing and also for the medical kind that I'm doing by going to www.ozonecourse.com. And then we'll give you the rundown